Welcome back. We are talking to Dr. Christine Seaworth about something that you have and you may not even know you have. We're talking about arthritis in your big toe. Pretty specific here. What are the symptoms?
Some of the symptoms are going to be pain, swelling, really stiffness, and difficulty with push-off and increased activities like walking, running, and going up and down stairs.
So we're talking about something pretty painful, and you'd feel that doing just about everything.
Yes.
Wow. Okay, so before the treatment options, what were they?
Really, it was if you had very early arthritis to take the bone spurs off and help release some of the scarring and inflamed tissue around the joint. But for more aggressive arthritis, it was to do a fusion, which means you make the bones grow together, but the big toe becomes stiff and you lose motion.
Okay, so can you point out, you've got a little model here, where we're talking about exactly where the pain would be?
Sure, so it's going to be in the big toe, at the base of the big toe, the joint, the one that moves, allows you to push off. And people would develop arthritis through here, and then they get bone spurs on the top. This is your small toe for reference here.
Okay, so now what can people do?
So this is the Cartiva implant, which is a very new and exciting option for people because it allows us to resurface the joint surface. We take out the area with arthritis and we insert this plug, and it's like a contact lens type material, and it allows there to be increased space again and increases your motion.
Wow. So what's the recovery look like afterwards?
So for this, it's very exciting. You can walk right away. You're going to have increased motion, and improved pain for up to 6 months, but people are doing well at 5 years, up to 96%, which is really good news for us.
No kidding.
If for a traditional fusion, you'd have to be off your foot for 6 weeks before you even started to walk.
And you'd lose all of the motion.
Yes.
Wow, that's great. And you're doing this at UT?
Yes.
This is really exciting stuff. Okay, so when you see somebody who comes in with something like that, is there anything that they can do before they get to this point?
Sure. Some of the things we talk about that are non-operative treatments are taking over-the-counter medications like anti-inflammatories and Tylenol. We also talk about wearing a stiff shoe that keeps your toe from bending when you're walking, and we also will do sometimes steroid injections into the joint.
Wow, so that's a really good option.
Very good option because it keeps your motion and keeps you moving.
Yeah, we appreciate that. That's great. Well, thank you so much for coming on and talking about this. We appreciate it.
Thank you so much.
All right, well, Heather, let's check in with what the weather is doing.